Welcome to What's Happening at Tri-City Medical Center. Our guest today is Dr. Samani. Every year, about 750,000 Americans have a heart attack. During this show, we're going to talk about heart attacks and what can be done to prevent them from happening to you or a loved one. Welcome to the show, Dr. Samani.
Thank you so much for having me, John.
So let's start by saying, what is a heart attack?
So heart attack is a situation which happens to the heart because the heart starves for oxygen and blood. Heart is a pump and it needs its own supply of blood and energy. And inside the heart, there are some small arteries which are called coronary arteries. And these arteries carry blood and oxygen to the heart all the time. So if this artery becomes narrow from built up of cholesterol, fat, or other material, the blood flow to the heart muscle can be blocked. And the heart muscle starves for blood and oxygen, and they can get damaged or die. Basically, that situation, which is associated with chest discomfort or chest pain, is called heart attack or myocardial infarction.
So what are the warning signs?
Actually, unlike many movies, the common presentations of heart attack is not intense or severe many times. It can come on slowly. For example, any chest discomfort or pressure-like or feeling like a squeezing at the back of the chest bone, especially when it comes with exercise or activity, could be due to heart attack. Sometimes this pain is not necessarily at the back of the chest. It can be somewhere at jaw, shoulder, back, stomach, or even arm or forearm. There are some other clinical presentations of heart attack. For example, the chest pain which is associated with nausea, vomiting, dizziness, sweating, or having cold or kind of clammy skin. And sometimes heart attack can present itself with syncope or fainting. All these presentations can be due to heart attack.
You know, one of the things I heard you say, you phrased it a little differently than I've heard it before, and I think it's important. You talked about the back of the chest, and I've always had the question about, what's a muscle pain from exercise or lifting weights or carrying boxes, and what's the heart attack pain? So I guess that's what you're getting at when you say the back of the chest. It's not in the pectoral muscles.
Exactly, and especially because we can get some muscular pain at the back of the chest bone, but the difference of the heart attack and kind of like muscular pain is that the pain is usually like intense and it comes with exercise or activities, but if you take some rest like few minutes after, if it usually a heart pain should go away. But if it persists there and is associated with, especially with other clinical presentations, as I mentioned, sweating, nausea, vomiting, shortness of breath or difficulty, they need to be taken seriously, especially in people that they had history of heart disease or they have some sort of clinical risk factors of having heart problem.
Let's talk about angina. Is it closely related to heart disease? Is it heart disease? What are the differences?
That's a very good question, actually. Angina or angina is the same kind of painful feeling at the back of the chest bone, which usually comes with exercise or activities. Angina, people with having history of heart disease in the past, they are pretty familiar with this feeling, with this angina, which usually comes when they do activities or when they do some sort of exercise. But not every angina is heart attack. The angina, which is more intense in presentation or severity, it lasts more than usual, and it doesn't go away with taking rest or taking the required medications. Can be serious, and it means that you might be having a heart attack.
Can you give us an idea in terms of number of minutes when you say long-lasting? What would a long-lasting angina attack be?
Especially for patients that they have this history of angina, we always tell them that they need to take rest if they feel like that the angina is presenting. And they always need to have their medications, the under-the-tongue medication, nitro pills, with themselves. They need to take one pill, wait for 5 minutes, another pill, wait for another 5 minutes, and they can also take up to 3. But after 15 minutes, if the heart pain or the angina is not going away, they need to call for help.
Now, what if worst case happens and you're having a heart attack or you think you are? What should you do?
Actually, that a person who feels that they are going to have a heart attack, they should not drive themselves to hospital or they should not wait. They should call 911 right away, because the paramedics with the ambulance team, they can do a test quickly called ECG or electrocardiogram, which can show if the person has acute heart attack or not. Because if a person has a heart attack, he or she needs to be transferred to the closest hospital possible to get clot-busting medications or a procedure called coronary angiogram to open up the clogged artery and to save the rest of heart muscle from getting further damage.
What kind of tests are available to predict your risks?
So there are so many tests that we can offer to the patients to evaluate their clinical risk factors and also the chance that if they have heart issues or they are going to have heart attack. The first thing, of course, for evaluation of any patient is getting a full history and performing a thorough physical examination. But if based on our evaluation, we think that a patient is suspicious to have heart issues or coronary artery disease, we offer them to have some sort of stress tests, such as ECG, treadmill exercise test, or stress echocardiography, which is done by using an ultrasound, and then or other modalities such as coronary CT scan or nuclear stress test. And if any of these tests show that they might have a moderate or large plaque or a blockage in the artery, we offer them to have a coronary angiogram or heart catheterization.
Is there a recommended period of time? First of all, is there an age where you would recommend that even independent of symptoms, or is that always connected to the presence of some sort of symptom?
Usually we tell that all the adult, especially like anybody with having kind of like clinical risk factors such as high blood pressure, high cholesterol, diabetes, obesity, physical inactivity, smoking, other risk factors, to have periodic risk assessment by their physicians or cardiologists. But usually we said any adult aged 20 or older, they have to have periodic risk assessment at least every 3 to 5 years in order to make sure that they do not have clinical risk factors of heart disease or heart disease.
Okay, so 3 to 5 years starting at a pretty young age.
Absolutely, yes, because you never know if based on your background or your lifestyle situation, you may have some clinical risk factors, and the earlier that you identify them, the easier you can control them.
Well, we have about a minute left, and I'd like to focus on you. What's the most intriguing part of your practice?
So the most intriguing part of my practice is preventive medicine. Basically, as a common scenario, I see a lot of patients with having acute heart attack in emergency departments that they do not do well. But after taking care of them in hospital, when they recover and we send them home in a better situation, the thing is that the story is not finished there. I would follow that patients in my clinic and I would go over all their clinical risk factors in detail and try to help them to identify their risk factors and try to minimize them. Interestingly, after working with them few weeks or few months, the much improved feeling that they have toward their health condition and the progress that they make in order to minimize their risk factors, it's the most rewarding aspect of my practice.
Well, I can see that from the smile on your face.
Thank you so much.
Thanks for that great information. Dr. Samani is board certified in adult echocardiography and nuclear cardiology, and she's highly trained in heart catheterization, coronary angiography, and pacemaker insertion. We want to thank her for joining us, and we want to thank you for watching this segment.